The top 5 vitamins to unblock arteries and increase blood flow. Atherosclerosis is the buildup of fats, cholesterol, and other substances in and on the artery walls. This buildup is called plaque. The plaque can cause arteries to narrow, blocking blood flow. The plaque can also burst, leading to a blood clot. This buildup is called plaque. The plaque can cause arteries to narrow, blocking blood flow. This results to cause blood clots to form in the arteries leading to the brain, blocking blood flow and potentially causing a stroke. Your circulatory system plays a critical role in keeping you alive. Blood vessels carry blood to the lungs for oxygen. Then your heart pumps oxygen-rich blood through arteries to the rest of the body. It is important to understand what happens inside the walls of our arteries, and how it can be affected by factors such as stress, diet, and smoking. The walls of our arteries are made up of a layer of smooth muscle cells called endothelial cells. These cells play an important role in regulating blood flow and preventing clot formation. When these cells are damaged or weakened by stress, poor diet, or smoking, it can lead to a range of health problems including high blood pressure and atherosclerosis, hardening of the arteries. LDL cholesterol is a type of fat found in the blood that can cause health problems if it builds up too much in your arteries. When there are gaps in your arteries, LDL cholesterol begins to accumulate around them to prevent them from leaking. This can lead to an increase in total cholesterol levels and an increased risk of heart disease, stroke, and other cardiovascular issues. The condition of your arteries is an important indicator of your overall health and well-being. If you don't take the necessary steps to improve the health of your arteries, they may continue to be damaged by unhealthy lifestyle choices such as smoking, lack of physical activity, high-fat diets, and excessive alcohol consumption. Making small lifestyle changes such as eating a balanced diet, exercising regularly, and quitting smoking can help reduce the damage to your arteries and improve your overall health. The symptoms of blocked arteries. Chest pain. Chest pain, also known as angina, can be a warning sign that plaque has built up in the arteries and near your heart. This pain may indicate that your heart is receiving an insufficient amount of blood. General weakness. General weakness is a symptom that can often accompany clogged arteries, and it can mean that the condition has reached its more advanced stages where it's affecting the rest of your body to the level where it's impairing your day-to-day function. Shortness of breath. Feeling short of breath is another common symptom of coronary artery disease. It occurs when the heart isn't able to pump enough oxygen-rich blood to meet the body's needs. In addition, if you have heart failure as the result of an injured or weakened heart muscle, fluid may back up in the lungs, which will also make it hard to breathe. In many instances, clogged arteries do not cause any symptoms until a major event, such as a heart attack or stroke, occurs. At other times, especially when the artery is blocked by 70% or more. But anyone, even people who are relatively young and healthy, could potentially have a stroke. While you can't do much about risk factors related to your age, gender, or family history, there are 4 important things you can do to lower your risk of stroke and improve your overall health. 1. Stop smoking. 2. Maintain a healthy weight. 3. Exercise. 4. See your doctor regularly. Just a quick reminder that this video is solely intended for educational reasons. If you have any medical concerns, talk to your doctor right away. The top 5 vitamins to unblock arteries and increase blood flow. 1. Omega-3 fatty acids. Omega-3 fatty acids are found in both marine and plant-based foods and oils. There are 3 types of omega-3 fatty acids. Alpha-linolenic acid, ALA, found in plant oils like flaxseed, soybean, and canola oils. Eicosapentaenoic Acid, EPA, found in oily fish, like salmon and tuna. Docosahexaenoic Acid, DHA, found in oily fish, like salmon and tuna. ALA is an essential omega-3 fatty acid, meaning that your body can't make it, so you must get it from the diet. EPA and DHA are not considered essential since they can be produced from ALA. However, this process is not very efficient and therefore cannot be relied upon to produce significant amounts of EPA and DHA. The American Heart Association, AHA, recommend adults take between 500 to 1,000 milligrams of omega-3 per day. Or you can consume it from whole food sources provide omega-3 such as fish and other seafood, especially cold water fatty fish, such as salmon, mackerel, tuna, herring, and sardines. Nuts and seeds, such as flaxseed, chia seeds, and walnuts. Plant oils, such as flaxseed oil, soybean oil, and canola oil. 2. Coenzyme Q10, CoQ10. Coenzyme Q10, CoQ10, is an antioxidant that your body produces naturally. Your cells use CoQ10 for growth and maintenance. Levels of CoQ10 in your body decrease as you age. CoQ10 levels have also been found to be lower in people with certain conditions, such as heart disease, and in those who take cholesterol-lowering drugs called statins. Coenzyme Q10, CoQ10, is a powerful antioxidant that has been proven to reduce the risk of cardiovascular disease. CoQ10 can be taken as a supplement. The recommended dose for CoQ10 supplementation is 30 to 200 milligrams daily or from food sources like fish, meat, eggs, and nuts. It helps clear your arteries by reducing oxidative stress and inflammation, which can lead to hardening of the arteries and blockages. Taking CoQ10 is an easy way to ensure that your heart stays healthy and functioning properly. 3. Vitamin K2. Vitamin K2 acts to prevent calcification of arteries, and it can reverse calcification after it happens. Secondly, vitamin K2 also uniquely activates a hormone in our bones named osteocalcin. This activation step is necessary and essential for the transfer of circulating calcium out of plasma into the bone matrix. If you like, you might begin taking between 100 and 300 micrograms of vitamin K2 per day. Alternately, you may get it from whole foods like natto, eel, cheese, beef liver, chicken, butter, sauerkraut, and egg yolk. 4. Vitamin C and vitamin E. Vitamin C helps vitamin E work better in your body. It also improves the way your arteries work. Together, these two vitamins help protect your arteries from oxidized cholesterol. They also help your arteries relax and open up more. Studies demonstrate that those with gum disease also have a higher risk of developing cardiac issues because of the bacteria that infect the gums and cause gingivitis and periodontitis also travel to blood vessels elsewhere in the body where they cause blood vessel inflammation and damage. Tiny blood clots, heart attack, and stroke may follow. Vitamin C is found in many fresh fruits and vegetables, such as citrus fruits, berries, potatoes, tomatoes, peppers, cabbage, Brussels sprouts, broccoli, and spinach. But can also be made into dietary supplements. Research suggests that eating foods rich in vitamin C is essential to a healthy working body. 5. Garlic. Garlic is one of the most powerful superfoods available. Not only is it antimicrobial, antibacterial, and antifungal, with antioxidant and anti-cancer properties, but it's also among the top foods that unclog your arteries. Many studies have proven raw garlic's ability to reduce cholesterol and blood pressure. One study showed that eating just 1/2 to 1 clove of garlic per day decreased total serum cholesterol levels by 9% in the participants studied. You can take up to 2,000 milligrams of garlic daily to help your arteries get clean. What causes clogged arteries? The first and most typical reason is high blood pressure. High blood pressure damages the blood vessels by making them more rigid and by damaging their interior lining. The damaged lining increases the risk of fat deposition, thereby impeding blood flow. Due to resistance of the blood vessels, the heart must work harder in order to sufficiently supply the body with oxygen-rich blood. Continuous strain on the heart can cause an increase in the heart's muscle mass, and without enough space it cannot properly function. When the blood supply to the coronary arteries is compromised, insufficient oxygen exchange takes place, and part of the heart muscle may die. This is known as a heart attack. Untreated high blood pressure can damage other important organs over time, such as the brain, the kidneys, and the blood vessels. 2. High cholesterol. If there's too much cholesterol in the blood, the cholesterol and other substances may form deposits, plaques, that collect on artery walls. Plaques can cause an artery to become narrowed or blocked. If a plaque ruptures, a blood clot can form. Plaques and blood clots can reduce blood flow through an artery. 3. Diabetes. When you have diabetes, the body either doesn't produce enough insulin or can't use the insulin properly. Over time, high levels of glucose can build up in the bloodstream, causing atherosclerosis, a condition in which narrowing or blockage occurs in the arteries. 4. Rheumatoid arthritis. Inflammatory substances called cytokines fuel joint destruction in RA and blood vessel damage in cardiovascular disease, CVD. Inflammation causes plaque buildup in the arteries, which slowly narrows blood vessels and blocks blood flow, and is the main cause of heart attack and stroke. Thank you so much for viewing my video today. As usual, I send you my best wishes for good health, prosperity, and happiness.